joining us this afternoon to give us a sense of how she's viewing the budget. Ms. Reddy, great having you. Now, there was an ask with regard to the kind of incentives that hospitals required. Budget, does it do enough in your opinion? Ma'am, I believe you're on mute.
Oh, I think the budget looks at the broader ecosystem of healthcare. And I say this because, she started with the recognition of NCDs, a network of clinical trials, which will definitely and encourage biosimilars production in India, which will actually bring drug discovery to India. As part of the ecosystem, she enhanced allocation to health to 1.1 lakh crores and went to skilling, where 1 lakh people will be skilled allied health professionals. She also addressed issues of geriatric care, mental health, and setting up emergency centers. So, beyond that, I think it's important to recognize that they're not just, while they're looking inward at India and strengthening Indian healthcare infrastructure by envisioning 5 medical value hubs, they are also looking at export of healthcare services, which is very encouraging. I think beyond what was said in the budget, we really need to look at the fine print, and we as healthcare providers will definitely use this to make sure that that we bring value into the healthcare system and continue to attract FDI into this very attractive sector.
Right. Ms. Reddy, stay with us. Lots more to talk about with you. But let me also welcome on board Anil Parab, the co-chair FICCI Capital Goods Committee and whole-time director and member at L&T board as well, joining in on the show right now. Mr. Parab, great to have you today on ET Now. With this 12.2 lakh crore rupee infrastructure push that we've heard in the budget, tell me, does L&T have the kind of capacity to meet this kind of massive demand as of yet?
Yeah, I think if you see, this is only 9% increase over last year capex. So I would say that capacity is not a constraint.
Disappointed, sir, with regard to the growth number, just 9%, you call it?
Yeah, see, this 9% growth, what you're looking for, I think your question was whether L&T has a capacity. I said that that's not a constraint. L&T is also doing a lot of infrastructure project outside the country. So I would say that the capacity build-up is not a constraint.
And the 9% itself, in terms of the number, do you believe that that falls shy of what you would have hoped for?
I would say that gives a continuity of growth, and I think what we should also keep in mind, the private capex also is improving in last 2-3 years. So considering that there is a momentum in private capex, this 9% I think is good for the growth of the economy.
Manufacturing R&D as well. Given that you at L&T have pretty much championed defense R&D, does the new 1 lakh crore rupee RDI fund finally give heavy engineering the kind of fuel that it needs to build a world-first technology in India?
See, up till now, I would say that operationalizing of this fund details are still awaited. As of now, okay, it is more of individual companies are doing their own product development. I think we'll have to wait and see the details. If I would say that if it is good for partnerships with the academia or some of the defense organization, it will be useful.
Here, the government is also looking at public-private partnership in the healthcare sector. Do you think that brings in a lot of opportunity for the private sector healthcare companies?
I think it definitely brings an opportunity, but more than anything else, by enabling skilling, they are enabling us to build the fundamentals for a very strong healthcare system for the future, which means that, less Indians would really go abroad for treatment. We'll be able to attract foreign patients to India for treatment. I think these are important while providing basic healthcare for all of India.
Also, Ms. Reddy, if I could ask you, you yourself are betting very big on AI, on genomics, right, at Apollo. Does the budget today provide that sort of real tax breaks, if you will, at all for digital health shift? Or would you say that this is still pretty much a luxury? And also the fact that FM talked about a wider insurance coverage as well. How does that change things for you?
So in terms of digital and AI, I have to say that it is a cost, but it is a cost that you need to incur now to be relevant in the future. And we will continue on this journey. Yes, our spending in AI and digital is quite heavy, but it enables us to reach people in Tier 2 and Tier 3 cities, and I think that matters. In terms of, are we moving in public and private sector partnership? I think we're very much there in that space that we're able to do that. But beyond that, there is, I must say that the budget enables investment into healthcare, and that's really what is crucial at this time, and enables us to build our own intellectual property.
Okay, Ms. Reddy, we'll let you go on that note. Thank you so much for joining us this afternoon and giving us that perspective with regard to the budget.